Hello, my name is Linda, and welcome to our second presentation for primary care physicians. Today, with the help of my team member Samantha, we will be discussing electronic health record vendors. So I hope you enjoyed our last presentation, as that was our introduction to EHRs. Before we continue to our next topic, we wanted to briefly review what we went over previously to refresh your memories. Last week, our team member Judy spoke to you all about the broad range of topics regarding EHRs. In the presentation, she discussed the history of how the healthcare industry adopted electronic health records into our systems, what an electronic health record actually is, why you as a primary care physician should use an EHR system, the benefits of using an EHR, the barriers one will face when using or learning to use an EHR, and she briefly compared two vendors and finally talked about incentive programs for primary care physicians to adopt an EHR system. So today, we're comparing the features of two EHR vendors, Practice Fusion and Cerner, and how you can use them in your own practice.
Thank you, Linda, for starting off our presentation. My name is Samantha, and I'm going to be going over the differences between Practice Fusion and Cerner. To start, Practice Fusion is an open source, whereas Cerner is not. There's some pros and cons to that, obviously. Practice Fusion is also very tablet computer friendly. There's no cost. They have automated alerts, warnings, and suggestions, as well as user-friendly and especially appropriate for new users. There's no software to install with Practice Fusion, as well as no hardware to manage. Along with that, there is free support and training. As far as Cerner is concerned, it is suited for large organizations. It has real-time updates on information, and it actually meets the Joint Commission requirements for patient confidentiality. It makes fast and effective decisions as well. Although Practice Fusion and Cerner are cloud-based, we will be comparing these differences in features, including home screen setup, demographic information, CPOE and e-prescribing, active medication list, lab results, user interface, and patient portals. To start off, here we have the Practice Fusion homepage. As you can see, the overall look is clear and easy to navigate. It has features including ICD-10 Ready. It's an API client user interface, and you can add documents as well in the main tab in each patient's chart. Moving along, here we have the Cerner homepage. As you can see, there's a lot more detail compared to the Practice Fusion. However, with more detail comes more information, so this can be seen as a pro and a con. The next feature we will be covering is demographics. As you can see, both Practice Fusion and Cerner collect different information about their patients. Practice Fusion does satisfy meaningful use, but keep in mind that it is a free open source, so privacy may be an issue. Here is an example of what the Practice Fusion demographics page looks like. Patient information can be easily found by clicking the Side Chart tab and then clicking the Profile tab. The Cerner demographics page is displayed here. Patient demographics can be easily accessed by clicking the Patient Information tab located on the left-hand side of the software. Next, we will go over the computerized prescription order entry feature in regards to Practice Fusion. CPOE with Practice Fusion fulfills meaningful use requirements. You can also easily access patient e-prescribing history for medication reconciliation, as well as e-prescribe to over 98,000 pharmacies. And here we have an example of what the active medication list looks like on Practice Fusion. It is easily accessed through the patient summary page. CPOE in regards to Cerner software allows physician and practitioners to electronically interact with pharmacies, payers, and managers. A key feature is that it notifies physicians through the message center when a patient requests a prescription renewal, as well as performs automatic prescription benefit checking for users. Here is an example of what e-prescribing looks like on Cerner. It is accessed through the patient's specific record and must be customized when first logging into the system. You can add orders for medication and labs by clicking on the Add button. Next, we have an image of what the active medication list looks like for patients on Cerner. Moving forward, the next feature between the two systems that we will be comparing is lab results. Here is a screenshot of a lab result on Practice Fusion. It can be accessed through the Patient Chart tab and then the top Flowsheet tab. Following this presentation, we will have 2 links to YouTube videos that delve further into lab results associated with both softwares. The Cerner lab results can be accessed from the Patient Information tab located on the left-hand side. Here we have some learnability or usability features associated with both Practice Fusion and Cerner. Practice Fusion can be accessed on a desktop or tablet and provides clinical decision support. Cerner provides real-world data, research registries, and has 24/7 IT support. With Practice Fusion's free patient portal, patients have access to a variety of features. This includes secure messaging directly with their physician, which can provide faster answers to their questions. The patients can also answer intake forms before arriving at their appointment, share and view lab results, diagnosis, and much more. Practice Fusion's patient portal does also meet meaningful use requirements. Cerner EHR provides very similar features to Practice Fusion, such as live patient information through their patient portal and sharing of lab results, but Cerner also provides customization of the features which Practice Fusion does not. In general, Cerner is more of a hospital-based EHR system, whereas Practice Fusion is a web-based EHR and more suitable for smaller practices. Cerner needs advanced IT support, which means there would be more of a financial investment. Practice Fusion does not require IT support, which could save you financially. However, this means that your practice would need to be more tech-savvy on their own. So overall, both EHR vendors are excellent systems. It just depends on what type of practice and what you think would suit you, your staff, and your patients better. In our opinion, Cerner provides more features and information to the user. However, Practice Fusion is more user-friendly and aesthetically pleasing. Most importantly is that both EHR systems are meaningful use qualified. It is your decision to decide which will provide you the most benefit. Thank you for listening. Please stay tuned for our third presentation.